for me, mostly it was I didn't feel like doing anything. You don't feel like eating, you don't feel like being with people. You just want to, for me anyway, I just wanted to shut myself off and then forget about everything, not disconnect from the world, so to say.
Never expected it. And there was no demand from all in. They're going to look at the four corners of the whole situation. And I said, no, that this thing can never come from a person like this. And when it comes, so it's like a bang like that. And before you know it, we are deep down into depression.
Getting that admission for me, it wasn't giving me joy because I felt this was not the right time to be in school. My mates are rounding up and I'm just getting admission. So what's the essence of being happy about the admission?
It is no longer news that events around us could have devastating effects in our lives. Events such as death, disaster, failure, abandonment, and even failure to meet up one's responsibilities. Now, these events happen to everyone, with no respecter of gender. Depression is a severe mood disorder in someone's life, which comes due to events or circumstances that are dear to the individual. For Juliana Detila, though not her real name, it was like seeing her life embarking on a journey without her control.
After when I finished my secondary school, I wrote JAMB once. So after the JAMB, I was actually waiting for the admission to come. I waited patiently, but I waited for 3 years. So while waiting, I felt discouraged. I felt this is not what I want for myself. I actually felt it's when I finished my secondary school immediately, then I get back to school. I resume or gain admission. But fortunately for me, I have to wait for 3 years. So while waiting, my mates were, some that were opportune to get the admission earlier, they were already close to they're already rounding up from school. So I was so discouraged. I got more depressed. I started calculating the years that I'll be rounding up, and I was like, God, how old will I be then? My mates will be married, my mates will be this, they will have this. I was just worried, and I became more depressed. So depressed that, in fact, sometimes I feel like harming myself. I feel like there's no point living when my mates are moving, I'm still backward. I don't even want to see anyone around me. I just want to be alone. I keep to myself. I don't want to socialize with anyone. I just want to be. But deep down my heart, I was really, really disturbed. I was really passing through hell. Sometimes I would just come, I will appear, but people may be seeing me like, oh, this guy is looking nice. But deep down my heart, I wasn't really happy.
Depression is a form of mood disorder where you have sad, low, or hopeless state for at least 2 or more weeks, or anhedonia, loss of interest in previously pleasurable activities, nearly every day, all day, for at least 2 weeks, with an association of at least 5 of the following 9 symptoms: loss of appetite or increased appetite, weight gain or weight loss, more than 5% of body weight. You have sleep problems, either insomnia, poor sleep, or hypersomnia, excessive sleep. You have poor concentration, you have poor focus, you have psychomotor agitation or psychomotor retardation. You have feelings of helplessness, hopelessness, worthlessness, inappropriate guilt, and in severe cases, you can have suicidal ideation.
The case, however, is not different from John Tion, also not his real name, a young lawyer who had depression in his late 20s.
Experience with depression, I think, was during exams. The law school exams are arguably the most difficult exams in Nigeria. So it was a very trying moment. And I think what helped me through it was having an understanding family, having friends who pulled through, and then, constantly making an effort to not seclude myself, but then, let all that affection from family and friends come in. So I think that was, basically what helped. It's not really about strength. That's something people out there should know. When you're depressed, it does not mean you're weak. It does not mean you lack character. It just means, for me, it was a period of emotional anxiety. I was going through a lot. I think for me, mostly it was I didn't feel like doing anything. You don't feel like eating. You don't feel like being with people. You just want to. For me anyway, I just wanted to shut myself off and then forget about everything, not disconnect from the world, so to say.
According to World Health Organization, depression is the leading cause of disability and most common illness worldwide. The World Health Body also estimates that 350 million people are affected by the disorder globally, of which about 7 million people have been diagnosed with the disorder in Nigeria.
Okay, it's about 20%, so 1 in 5. 1 in 5 people will have depression. So that's the prevalence, So it's quite a number. We're talking about maybe 40 to 60 million Nigerians who are living with depression. A lot of them not realizing that they have depression because they're blaming outside forces and other people for their problems, And so that's a statistic. It's more common in women, like 5 to 2, 5 or to 2, or some say 3 to 2, some say 5 to 2. So it's twice as common in women than it is in men, and that might be people are hypothesizing why that is. Some say that the female sex hormones play a role in depression. Others say that women are more open and will, complain if they have problems, unlike men that are more prone to keeping it to themselves, and so it's recorded more in women because women actually come out to complain that they have depression, and that might be responsible for the increased percentage in women compared to men. But it's a disease that is twice as common in women than it is in men.
Although there is a growing discussion on what causes depression, but experts believe one of it is hereditary.
If somebody has a family history of depression, that would be a biological predisposition. It's all about genetics. If, for example, you consider that when you talk to a doctor about your blood pressure or diabetes, doctors would often ask you, do you have a family history of hypertension? Do you have a family history of diabetes? Which means that you have an increased risk of having those conditions. So the same applies to depression.
You also have external stress. One common thing that causes depression is child abuse. So if you're assaulted as a child or sexually abused or emotionally or physically abused as a child, that can predispose you to depression. Certain medical illnesses, so if you have like cancer, stroke, heart failure, heart attack, these can also, because of a result of the medical illness, you can also get depressed. Substance use, for 30% of patients who use marijuana, cocaine, codeine, nicotine, and other substances, they will also exhibit depression as a direct result, of their substance use. Loss, any type of loss, even if it's a separation, divorce, conflict within the family, and loss of a job, death in the family. These can all predispose you to depression. Also, positive life events like, getting married, like having a baby. These can put your system under stress, and can lead to depression, even though it's a positive event.
We'll find out that a lot of patients who have diabetes may also have depression. People who have stroke, up to 60% of them may have what we call a post-stroke depression, just to mention a few of the biological causes. I'll take psychological and social causes together. Psychological causes, basically some people, their psychological build-up, they are people that we call warriors, okay? They worry about many things. They may be more predisposed to having a depressed mood than to other people. And of course, you look at social causes, look at our socio-economic environment, look at people who are exposed to all sorts of abuse, physical abuse, sexual abuse, look at bullying in our schools and amongst our teenagers. So these are examples of social causes of depression. So you really cannot put a finger on one thing. To simplify it further, let us look at it like this. Usually, a first episode of depression may be associated with what we call a psychosocial stressor. Those are significant events around a person's life that might make a person depressed. It might be one event, it might be multiple events working together to make a person depressed.
In a changing world characterized with crisis, domestic challenges and optimism to meet financial obligations, one's inability to mitigate these requirements at different present circumstances may eventually lead to mood disorder. Consequently, sadness, angry outbursts, hopelessness, among others, envelops the mind of the individual, culminating to suicide, which has been identified as a risk factor in depression. Depression affects more women than men, and those affected are within the ages of 15 and 29 years old. This group forms the adolescent group in the society who are within the formative stage of independence in life.
It's more common in women, like 5 to 2, 5 or to 2, or some say 3 to 2, some say 5 to 2. So it's twice as common in women than it is in men, and that might be people are hypothesizing why that is. Some say that the female sex hormones play a role in depression. Others say that women are more open and will, complain if they have problems, unlike men that are more prone to keeping it to themselves, and so it's recorded more in women because women actually come out to complain that they have depression, and that might be responsible for the increased percentage in women compared to men. But it's a disease that is twice as common in women than it is in men.
The case of depression is so pathetic because it goes with stigma, which is tied to cultural beliefs and witchcraft in some communities. It is a complex issue that has led to some of the victims being incarcerated and as a solution to restore normalcy in those affected.
Well, I think that the church has a lot to do. The first is that the church, provides community. The church is a community, gives you a supportive community. You have people who love you. You have people who want to share your burdens. You're part of a community. That's what the church invites you to a community. Because what happens with depression is that you want to be alone. You're just alone. You're all by yourself and you're feeling powerful. You're feeling, I don't have control. Something is happening and I don't know what to do. So at that time, you need a supportive community. And that's what the church offers. You talked about maybe someone comes. In some cases, people can, go to the church because they say, I can't handle this problem alone. And, maybe even if they've not been going to church, you just find them either visiting a pastor or going to a church because I have a problem and I need help. Sometimes the one who is depressed even has nothing to do with the church, and maybe you just see someone and say, you find out, you get to see, because when people are depressed, they try to cut off from things, they are alone, they don't talk much, you can see it even from their demeanor that something is wrong with this fellow. So when people come or you get in touch with them and they are depressed for whatever reason, failure, defeat, loss, disaster, whatever happens, and they are complaining, the first thing that I like to do is to not minimize what they are saying.
That I would just raise as number one is godlessness. For people who does not understand the concept and belief in God. Don't forget, I said understand the concept and belief in God. Who doesn't understand how God works? Naturally, they are likely to fall into depression. Then one, then two, excessive materialism. When you just want to have and have and have, that the only thing that is in your mind whenever you wake up is you want to have this, you want to have that, you want to have this. Yes, it's not wrong for one to have, to aspire. But when the aspiration now become the only thing that you have, you don't understand to get to that thing, the challenges you might have in getting those things, most of the time it leads to depression. Then the comparison, when you compare yourself to others, it will naturally lead to depression. When what others are getting, you feel that you should also get the same or better, and all your efforts are not actually leading you to getting to where you want to get to. You would think that it will lead to depression.
The issue of religious leaders or traditional healers or some of these centers, that we have, or maybe that we might have seen of recent times that have been discovered, it's not that they do not proffer any solution at all to this problem, right? But we are saying that it is, far cheaper and better for us to approach the Orthodox method. And if you're going to be approaching maybe the religious leaders or the traditional leaders, they do not have evidence-based tools to be able to crack or maybe to diagnose you of what exactly is wrong with you, right? A religious leaders might want to use some of the holy books and then some of the wisdoms or maybe some of their own measures to counsel you, to give you the best advice they can spiritually and to pray for you. We're not discountenancing that. We're not against that. But we are saying that, look, beyond just word therapy, because if you have fracture right now, I can't just pray for you and pray away that fracture. I can't just counsel you or maybe counsel you and then I can tell you, okay, fine, the fracture is going to be fine. You're going to come over it. It's a broken bone, and the same way, right? If we the same way approach and care for the physical health, let's not take, with glove. Let's not treat it with our soft glove hands, right? The issue of mental health is critical. The issue of mental health affects the average productivity of anybody.
They prayed with me. They encouraged me. The pastor was always there to, they're really busy, but then he always made out time to speak with me, and I guess that helped a great deal. Having people who would drop what they were doing whenever I needed them to talk to me. So it really helped.
You have spirituality, which is an important tool for a lot of people, who are dealing with mood disorders like depression. But you also have science. You have studies based on research that shows that medical counseling, that is a specialty like cognitive behavioral therapy, like supportive psychotherapy, like multi-systems family therapy. These are all methods that have been studied extensively through science that have been found to be very effective for mood disorders. And so, what I'm advocating is that people generally should be aware of all these instruments, all these tools, all these help that is available. So you can now decide, okay, I need a little bit more spirituality today. Maybe tomorrow I need some medical counseling, either a bit of medication or cognitive behavioral therapy. So it's to empower people to know what they need when they need it, versus just saying spirituality is the only tool I have and everything that I do, or, even though there's medical science backing these other treatments, I'll only stick to spirituality.
Incidentally, the opportunities that bring in numerous groups who now manage depression outside the recognized professionals were not created by these groups, but of a systematic failure which is more pronounced. These failures are majorly seen as barriers, such as lack of resources, social stigma associated with mental disorder, and lack of trained health care providers. The shortage of experts in handling mental disorder is an age-long barrier. Now, this is more so in the ratio of psychiatrists and clinical psychologists to the projected 200 million population in the country, where few professionals are seen attending to a large number of mental disordered patients. People with depression can be restored to normal life, but it's not something that can be done by those affected. It therefore means that efforts should be geared towards involving close associates to assist the victims.
When I got to that moment, I realized that, I had to reach out to the church, reach out to my pastor, to my parents, to my friends. It's just let them in through on the things I was going through. And in fact, social media helped a good deal. Like, I posted what I was going through that moment, and, the inflow of love was just overwhelming. So it helped a lot that when some people saw that I have been bold enough to come out and say that, it's even more people started sharing their experiences. So it became a kind of therapy that period. It just wasn't then about only me, but then I found out that it was an avenue that others could, so reaching out, you'd be surprised, by reaching out, it would give others courage to also, face their fears.
Inform my parents about this. So I have to travel back home. I told my parents this is what I'm passing through. Say, don't worry, with prayers you can overcome it. It's one of those things that used to happen in life. For me, that having people call me bold and brave for doing something like that at my lowest, seemed to help. So I know people would think social media is a bullying tool, it's bad, but in that point in my life, it was a big plus. Having a community that would rally around me and then support me. Yeah. So I was like, God, what's happening to me? I think I need to go back home and inform my parents about this. So I have to travel back home. I told my parents this is what I'm passing through. Say, don't worry, with prayers you can overcome it. It's one of those things that used to happen in life.
I have a friend, I have a very close friend of mine, just one. And I went and I discussed. I said, look at what is happening to me. Initially, I said to, keep it to myself. But when I could not bear it anymore, because I was just going down. I saw myself going down every minute, thinking of how to, end it all. But this person, my very close friend, like that, a young man, and just himself, and I can always, whatever comes from him, I know that this person will just tell me the truth. So when I got to him, I said, met him, and I discovered, poured out my heart to him, and then he came up with advice and solution, and then I started picking up.
Most of the time it's not the person that realizes that they're depressed. It's the family members that notice that, or the close friends notice that the behavior of the person has changed. The person is withdrawing, the person is not sleeping, not eating or eating too much, sleeping too much, low energy, never interested in participating in family activities, and so, there may be something strange about the person's behavior. So that's usually what will happen. And the first step is to get an assessment, right? For you to treat a problem, you have to understand the nature of that problem. There are different types of depression. You need to be able to categorize it. You need to find out what are the triggers, what is the situation in this person's life that's making them more vulnerable to depression. Are they dealing with loss? Do they need grief counseling? Are they dealing with a stressful life event? Is there a death in the family? Are they having a medical problem? Is it undiagnosed cancer in their body that's making them depressed? So you have to have a full evaluation. You have to document the exact nature of the depression, the precipitating factors, the perpetuating factors. After that, then you can know what kind of treatment is best for the individual, whether it's a combination of psychotherapy, which is medical counseling, and medication, or you want to start with psychotherapy alone, for a while, and then add on medication for a short period of time, or maybe for longer, depending on the duration of depression, whether it's a first episode or a second episode or subsequent episode of depression. So these are some of the things, but the first thing is the assessment.
Julian was in between life and death as she spent days in the hospital bed to gain her life back.
Because what happened was that I fell in coma at a National hospital. I just found myself, when I regained my consciousness, I found that I was on hospital bed, National Hospital. I was like, I asked people around that, what's happening, what's wrong with me? They said, thank God, so you can talk now for March, April, May, June, July to July. I was like, please, what's today's date? What's just happened to me? They said I shouldn't worry, that the doctors will come back to me and explain to me. Then when they came, I was like, oh, wow. So finally I can respond back to treatment and all that. So thank God for my life. So I started asking everybody, please, what happened to me? I said, okay, that actually the doctors couldn't say this is what was really wrong with me. That maybe because I have an emotional, I don't know, so it led to me being in coma. I was in intensive care unit, and I think we were like 3 in the intensive care unit. So 2 died, but God, I was just fortunate. I was privileged. God's grace helped me. But I just want to tell you that was what I passed through.
She was lucky to have survived her case through the efforts of her loved ones and early treatment. Now she lives a normal life, but the experience of all that she went through will never be forgotten. The pains and trauma depressed persons go through are better experienced than imagined. And in most scenarios, the society seems not to tag along with them, hence the urge to commit suicide sets in. But early detection and diagnosis will go a long way in bringing individuals back to their original lives.